all across the country, physicians and patients are asking themselves the question, where can we get tested? We know that as a nation, we need to dramatically ramp up our testing of COVID-19 in order for us to contend with this epidemic. In the past few days, President Trump and his administration have released billions of dollars of funding, relaxed regulatory requirements so that we can scale up testing around the country, and we applaud those efforts. There have also been examples of recent innovations. For example, drive-through testing, the idea that a patient could drive up to a parking lot of a hospital or a lab without leaving the comfort of their car and risking exposing others, get tested, and then be able to get an answer after they return home. Those are really exciting innovations. Today I want to talk about another exciting innovation that isn't getting nearly as much attention, but we think could have a tremendous public health impact around the country. And that's at-home testing. As physicians, we know that testing someone for influenza or coronavirus is as simple as doing a nasal swab. So the question we asked in a paper we published earlier this week in JAMA is, could patients self-test themselves for coronavirus? The evidence shows that self-testing for influenza and other respiratory illnesses is actually quite effective. There have been pooled meta-analysis in influenza showing a high sensitivity and a high specificity when individuals self-swab for influenza. There was also a recent study done in an emergency room setting that compared patients' comfort and ease and preferences around having a health professional do their swab versus doing the swab themselves. And the majority of patients actually preferred doing it themselves. So here's our big idea. We would develop a three-step process so that we could effectively screen, diagnose, and manage low-risk individuals from coronavirus without ever having to leave their house through a three-step process. Step 1, per the latest CDC guidelines, patients would have to be evaluated using telemedicine with a physician, who would then use the latest guidelines to determine whether a patient could be appropriately managed at home and receive the self-test. Step 2, a self-test would actually be mailed to their homes or delivered. Patients could then do the nasal swab in the comfort of their own home, guided by instructions, potentially even instructional videos. And step 3, they would mail the sample back to the lab and receive their results in their home in the next 2 days. So what are the benefits of this? Well, over the next few weeks, most experts expect that our clinics and hospitals will become overcrowded with coronavirus cases. So the public health benefit of such a testing service means that we're not overburdening a health system that's about to get significantly overburdened. And also, we don't risk transmission as people are waiting in crowded ERs. This is the same kind of benefit that we have with drive-through testing, but there's additional benefits of home testing. Number 1, we think it can be rapidly scaled up anywhere in the country. With drive-through testing, it's unlikely to reach people in low-density areas like rural communities. Also requires that people have a car. Drive-through testing also requires time of healthcare professionals who have to wait near the parking lot site in order to test individuals, which means that's one more health professional not there at the front lines to actually take care of those who are most affected by the condition. We also think that this could actually increase testing. We know that lots of people have barriers to going to a doctor and getting seen. This is the kind of service that could democratize such access and actually get many more people tested, many more cases found, so that we can actually effectively self-quarantine and manage those patients and avoid transmission to others. What it's going to take in order to scale this up, there's definitely going to need some federal action. There are FDA regulations about how testing works, and it varies by the method. We think in this time of national emergency, we need to relax some of those conditions while also assuring for the safety of patients. We also would benefit over time from comparative effectiveness research, looking at which are the right populations to get this kind of testing. We know that it's not going to be suitable for every type of person. There's going to be patients unwilling or physically unable to do at-home testing, and there may be other considerations as well. We should seek to do that kind of research, but do it in real time as the epidemic progresses, rather than wait for perfect, because we can't afford to. So we're very excited to share this new research with the community, and we'll look forward to the discussion. Be well.